If you need more than one card, by the way, again, just raise your hand and a volunteer will come and give you another card. All right, so if there's no questions, let's get started. We have the candidates for the Health District here. We did just learn that Mason Perry will not be able to attend this evening due to illness, so I will be reading a statement on his behalf. I'm going to scoot over here. Good evening, candidates. This is the Bear Valley Community Healthcare District, and I will introduce, from my left, Dr. Peter Boss and Mrs. Gail McCarthy. We will begin with opening statements. Dr. Boss, may we have your 1-minute opening statement?
Okay.
Oh, I'm sorry, one moment. Let me go with the timing. That's right, I promised I'd go with the timing, so that you would know.
Okay.
So it is, again, we are adhering to 1 minute for everything tonight. When you see the green card, that means you have 30 seconds remaining. When you see the yellow card, 10 seconds remaining. And when you see the red card, that indicates that your time is up at 1 minute. If you are speaking beyond the red card, you may hear this. And that will indicate to you that your time is up, for sure. Okay? Any questions? All right. All right, so let's start with opening statements. Starting with Dr. Boss, may we have your 1 minute opening statement?
Okay, I'm a board-certified emergency physician. I was born here in Big Bear in Doc Godwin's office, which happens to be the current site of Murray's Saloon. I attended K through 12, graduated from the University of Redlands, then Loma Linda University School of Medicine. I was the emergency department director of Hemet Valley Medical Center for 32 years and managed a group of 26 emergency physicians staffing 2 hospitals. During that time, I also worked part-time in the emergency room here in Big Bear. I was appointed to the hospital board and have been serving on both the finance and hospital affiliation committees. Under the current hospital board and administration, the hospital district is in the best financial condition it's been in years. And we recently signed an affiliation agreement with Riverside Community Hospital that will have far-reaching benefits for our hospital district. I made it.
Thank you, Dr. Boss. Mrs. McCarthy, may we have your 1 minute opening statement?
First, a few seconds to say thank you to the Chamber for arranging all of this so professionally and so well. Thank you very much. Hardest thing about being a candidate up here is can only talk for 1 minute, hard for me to do. But anyway, I have quite a long history of volunteerism in the Valley with arts-related projects. I did a whole lot of public speaking in the past for the American Cancer Society. And the last of my 25 years working in hospitals was spent 10 years at City of Hope. Most of my experience is cancer-related education, public education, screening for colorectal and breast cancer, letting people know that early detection is everything. It is everything. So I brought the experience to the board and very much want to stay there because I love what I do on the board.
Thank you, Mrs.
Thank
McCarthy.
you.
Thank you. I will now read Mr. Perry's statement, opening statement on his behalf. I was born in our hospital. I have lived in Big Bear my entire life, and I am now raising my 7-year-old son here as well. I worked in our hospital's emergency room before attending fire paramedic training. I graduated from the paramedic program and fire academy at Crafton Hills College. I have worked in Los Angeles County, San Bernardino County, and in Big Bear Valley as a firefighter, EMT paramedic. Working as a paramedic and in our ER, I have provided healthcare services to our citizens, and I understand your needs from the moment you get sick or injured and call 911 to the time you are discharged from our hospital and able to return home. As your elected hospital board member, I will ensure that 1, our hospital will always meet our community's healthcare needs. 2, we will always use our hospital's resources and money wisely. And 3, we will not raise your taxes. With our community's input and direction, I will make sure our hospital is always there for you. Okay, that concludes our opening statements. Thank you very much. We'll proceed with our first previously submitted question. Dr. Boss, we'll start with you.
All right.
Do you have budget experience, either through business ownership or in a management position? And if so, what is the hardest lesson that responsibility taught you about financial management?
As I mentioned in my opening statement, I was the manager of a group of 26 emergency physicians, which is a lot of times like wrangling cats. So I had a lot of business experience with that, did all the payroll scheduling, did all contract negotiations. And the hardest part, I guess, would be when there were disciplinary problems that I would have to deal with.
Okay, thank you very much. Mrs. McCarthy, would you like to answer that question?
Well, excuse me, I would just say too that the hospital, because of the current administration team, has brought financial stability to the hospital that has not been there for many, many years. Everyone in this room probably knows the revolving door, so to speak, for CEOs that we had in the past 5 or 6 years. That is now over, and we have adequate and very expert management. So yes, financial stability is probably the most important thing, we think. It allows us to do the things we know we need to do for the community because we have the funding now to do it.
Okay, thank you, Mrs. McCarthy. Our next question, Mrs. McCarthy, we'll let you take the lead on this one. What are the plans for the earthquake retrofit or replacement of the current hospital building?
We have begun, a separate committee has been formed to look into, there are many guidelines, government guidelines, policies and procedures that must be followed. We have a big decision to make in some areas of the hospital where retrofitting or build new. Pardon me. And I think this is a major thing for a lot of small hospitals that are the age of ours. But we're putting everything into researching what is best. We have one group that we have had come and look at the hospital, and probably they will be the ones that we will work with when we do the retrofitting. So we're definitely on it. I can't give you a date that it's going to start, but we're on it.
Thank you. Dr. Boss, would you like to address that question?
Well, as she mentioned, we're already actively looking at this. We're looking at the options and putting price tags on those options. One of the other things that we're doing right now, being a critical access hospital, we get grants and access to low-interest loans that other hospitals don't get. So we have a grant writer now looking at sources of funding so we can see when we get the price tags on these options, what type of funding we can get.
Okay, thank you very much. Dr. Boss, here's a two-part question. What is the status of the affiliation of Bear Valley Community Hospital with Riverside Community Hospital, and what do you see as the benefits?
Okay, as far, the affiliation, I think, is fabulous. One of the big things and why the Loma Linda did not work out is the physicians were not on board. I went down with the group. We met personally with the physician heads of all the departments, and they are fully on board. And so I think it's going to be a real big success just because of that. As far as what's involved, in a minute I couldn't even begin to explain, but one of the big things is patient transfers. Patients who need a higher level of care, particularly winter months. I used to spend in the ER an entire day finding a hospital to transfer a patient to. And we now have priority at Riverside. And Riverside community is a misnomer. It's a trauma center, heart center, stroke center. Just did a $500,000 remodel. It's beautiful.
Thank you. Mrs. McCarthy, would you like to address that question?
I can only echo that in that we got very, very excited about Loma Linda, and maybe we were more interested at that time, well, not interested, but impressed by name recognition. Pardon me, but when it came down to it, their focus was a little bit more on new projected projects for Loma Linda, and we just, everything we wanted them to partner with us to do was not forthcoming. So we went back to Riverside, who was elated to hear, to get John Friel's phone call to say, let's talk a little more.
Thank you. Mrs. McCarthy, if you acquire a seat on the board, what do you consider to be the most pressing issue?
I'm sorry, could you repeat?
Sure. If you acquire a seat on the board, what do you consider to be the most pressing issue?
Well, I think it's probably twofold. I think it is the affiliation, because we spend a great deal of time talking about the specialties that we need and don't have, and how much we want to have in the community. The second half of that would be continued financial stability. Is just so important to be able to have the money to do what you want to do, but more importantly, that you need to do, to offer the community what everyone deserves. So I would say affiliation, stability financially, and everything else that comes in line later. HR issues and different things that we're working on everything, but those two primarily.
Thank you. Dr. Boss, would you like to answer that question?
I think probably the seismic requirements are going to be the number one. That's the big thing that's facing us. But I agree that this hospital affiliation is number two. The potential there is huge, but it's going to take a lot of work to cultivate it to its maximum.
Okay, thank you. Dr. Boss, where do you see the hospital in 10 years?
Well, I see us with either a brand new hospital or a beautiful retrofitted hospital. Of course, I'm an ER doc, so either way, we're going to have a new ER. Hopefully, we will continue to be very financially stable, and I see us bringing a lot of services, old services back and new services to the Valley, I hope through telemedicine.
Thank you. Mrs. McCarthy, would you like to answer that question?
In 10 years, I hope we're saying, remember when we didn't have this and we didn't have that, and just look at us now. That's all I could say about that. Look at us now.
Okay, thank you very much. Mrs. McCarthy, making good decisions and having integrity are two important traits for any board member. Does your personal history reflect those qualities? Please give examples.
I'm sorry, I didn't quite understand you.
Making good decisions and having integrity are two important traits for any board member. Does your personal history reflect those qualities? Please give examples.
Very definitely, and it is of prime importance, I feel, as a board member. You represent your entire community, and your integrity, your trustworthiness, your honesty, your ethics are called upon every single board meeting. Most of all, I think every board member, and I am very adamant about this, has to constantly remind themselves that they are one of five. They are not the board. They are a member of the board. That's why there's 5 people on the board, because majority must rule. So yes, I think sometimes I could just say, I'm a little vocal about what's ethical and what's kosher and what's not. Because I feel that is my strongest duty to perform.
Thank you very much, Mrs. McCarthy. Dr. Boss, would you like to answer that?
Well, as I mentioned in my opening, I was an emergency department director for 32 years, which is kind of almost unheard of. I had to make a lot of decisions in those years with hospital boards, administrators, other department heads, so I think I probably have a fairly good track record of making good decisions.
Thank you. Dr. Boss, will you have any known conflicts of interest by serving on this board? For example, do you own companies or land or represent others that may create a conflict of interest for you?
No, I retired so that I can devote the time it takes to do this job as a board member. I resigned from the medical staff at the hospital. I have absolutely no financial interest whatsoever in the hospital district, so I feel I have absolutely no conflicts.
Okay, thank you. Mrs. McCarthy?
I too have no. I do a lot of other volunteer work in the community, but certainly not anything that overlaps or takes precedence over my duty as a board member.
Thank you. Mrs. McCarthy, several candidates have publicly stated that knowledge of the history of Big Bear is essential. We need leaders who look forward, not backwards. Innovation and technology are the cornerstones of successful and cost-effective organizations. When have you personally promoted innovation and technology?
Well, again, we are looking at new IT programs for the hospital. The telemed is important to us. Also, the fact that doctors now, as you know, if you go to your doctor, and he's no longer scribbling in a chart, he's typing your SOAP notes, as they're called, into a computer. And so we have to be on the cusp of having that as part of how we operate the hospital too. Again, having the funds to implement all these new programs is essential. And so we are looking, that's one of the things we're looking into grants to help us achieve that.
Thank you. Dr. Boss?
Well, one of the things that I'm extremely interested in, and fortunately the Riverside community also expressed an interest, is developing telemedicine. I personally spoke with the heads of neurology, cardiology, and they are all on board in developing a program so that we can get instant cardiology, neurology consults here, and hopefully in the future we can also be a telemedicine. You can have your follow-up visit here, not drive down the hill. So that's one of the things.
Thank you very much. Well, that concludes the previously submitted questions. I think I see some questions here from the audience that we will ask. We can start this with Mrs. McCarthy. Please explain the history of the hospital. I'm trying to see. Oh, okay. I'm so sorry. Dr. Boss, this question is for you. Please explain the history of the hospital and how it started with your mother.
Well, sometime during my early childhood, my mother, Brenda Boss, had this wacky idea to build a hospital here in Bear Valley. So I grew up participating in countless hospital fundraisers. She was absolutely selfless in what she did. Numerous trips to Sacramento, San Bernardino, and lo and behold, of course, her impossible dream came true.
Thank you. Mrs. McCarthy, this question is for you.
I'm afraid I'm hearing a lot of the history for the first time because I knew that Mrs. Voss, obviously our Family Health Center is the Brenda Voss Family Health Center. But I actually didn't know that you grew up here either. So what he said.
What he said. This question is for you, however. Could you please, Mrs. McCarthy, could you please update us on new equipment acquired at the hospital and apparently the SNF unit?
Oh, absolutely, and I'm so happy to do that. Probably about a year ago, we started looking at equipment, primarily the CT scanner and mammography, and made the decision right then and there that what we had needed updating and upgrading. So we have now new mammography equipment, new CT equipment, and in the skilled nursing facility, everything is being updated there. Also with the help of Rotary, which has donated $10,000 per skilled nursing room for redecorating, updating, doing whatever is needed to fit within that amount of money. And the unit is marvelous. It's just a little jewel inside the hospital.
Thank you. This question is for both candidates. So Dr. Voss, we'll start with you. There are many challenges facing small rural healthcare facilities. Which, in your opinion, is the greatest challenge facing our hospital, and how would you tackle this challenge?
Well, I think historically the biggest challenge has always been financial. And I think one of the best decisions ever made was to get the critical access hospital designation, which opened us up to a lot more funding opportunities for grants, low interest loans. But I think financing will continue to always be a challenge to a small hospital.
Thank you. Mrs. McCarthy?
I would certainly agree with that. Always financial. I've been a big proponent too, because I worked in much larger hospitals where there was a lot of public education, and I have been a proponent of let's do more education into the community. The community needs to know what a great hospital we have just because we're small. But the staff is awesome, the doctors are great, and that's what we want the community to know and embrace, the fact that they have an excellent choice, and we're working hard to make it a bigger and better choice with more specialties and so on.
Thank you. This question is for both of you. Dr. Voss, I'll start with you. What is your priority goal for the first year in office?
My priority goal right now is the hospital affiliation with the Riverside community. As I said before, there's real huge potential with Riverside as far as programs. We have a surgeon now, a general surgeon, orthopedic surgeon interested in coming to the community. They have a residency program, and they're going to be rotating residents up here. We have the potential to attract new young physicians. I'm really excited about this relationship.
Thank you. Mrs. McCarthy?
Absolutely. I think I would agree with that, and that would be my first choice too, the affiliation. It means so much to us. It means so much to have the kind of specialties that we need, because every one of us who has had to go down the hill, especially in nasty weather, it's very frightening. You already don't feel well or whatever, and now you've got to traverse the mountains. So it's really, we talk about it a lot in board meeting, and I think probably every board member would say the same thing, that it is the affiliation. It's exciting for us to think about what we might be able to achieve.
Thank you. This question is also for both of you. Could you please discuss your view of the appropriate relationship between the board and the administration of the hospital? Dr. Boss.
Well, I think our role as board members is supervision, not the day-to-day nuts and bolts. That's the administrator's job, and our job is not to meddle in that. Ours is to supervise and to make suggestions and corrections when necessary.
Thank you. Mrs. McCarthy?
Yes, as I said before, the board is composed of 5 individuals, presumably and hopefully all with the same objective in mind, and that is better health care, better selection of physicians and so on to the community. We are there on behalf of the community. All 5 of us have that in mind all the time. You know, running for an office on the board, it's not a popularity contest. It's a lot of work that you do. And you have to be ready to jump in and do a lot of work. And set your ego aside and say, what's best not for me as an individual, but for the community, and to improve every action the board takes.
Thank you. Mrs. McCarthy, could you answer this next question? What is the biggest challenge you have faced being on the board, and how did you handle it?
Well, I'd have to say the biggest challenge is kind of an odd one, I guess. If I want to be off as a topic, no, I'm not saying that right. If I don't agree, and I have had several occasions where something comes up and it goes to a vote, and I have to say, I'm sorry, I just got to vote no. Or, I'm sorry, I'm just really for this. That's for me personally a bit of a challenge. Not because I don't want to swim upstream, but just, am I doing it right? Am I doing the right thing by opposing? And it kind of comes down to do the right thing even if it hurts a little bit. That sounds so dramatic, but I don't mean it.
Thank you. Thank you so much. Dr. Boss, would you like to address that question?
I think the one thing I was impressed with is how much work is involved in being a board member. I remember when I was handed my first board packet, I mean, this thing is that thick. And then they said, here's the flash drive for the stuff we couldn't get in the packet. And I was amazed. I mean, the board really does a lot of work. But I got to say that I enjoy it, and it's well worth my time.
Thank you. I believe that concludes the audience questions. We will now ask you to please give us your 1-minute closing statement, starting with Dr. Boss.
Well, as I mentioned in my opening, under the current board of directors and administration, the hospital district is in the best financial condition it's been in years. That's not to say we aren't facing some challenges in the future with our seismic requirements, but again, we're in excellent condition. The affiliation, of course, I'm really excited about. It's going to take a lot of work, and for my part, we need the physician-to-physician contact to bring that to fruition. But I'm excited and optimistic about the future of healthcare in the Valley, and I hope that with your vote, I can continue to be part of it.
Thank you so much. Mrs. McCarthy, your closing statement, 1 minute, please.
Well, I too am hoping for your vote, very frankly, because I want to stay on the board. I think both of us up for re-election are very happy and proud of the fact that we've been a participant in a lot of the changes and improvements that the hospital has made in the past few years. And the constant surveillance of what do we need, what don't we have, what do we need. I too am very excited about the affiliation because when the public sees what that will do for our hospital, I just cannot believe that every single community person is going to be very, very happy we did what we did.
Thank you very much. At this time, I will read the closing statement, Mr. Perry's closing statement. Throughout my discussions with the CEO and others, I have learned about several issues the hospital and healthcare district may face ahead. However, the seismic update requirements are by far the biggest challenges looming. It must meet all of the California earthquake standards by 2030. This means that we need to retrofit our existing hospital or build a new hospital in 12 years in order to meet these standards. I understand that a new facility would create many opportunities to expand services and reduce the amount of time locals spend off the hill getting medical services. I think expanding the telemedicine efforts are needed as well. There are so many more opportunities with technology these days that can reach out into the community and provide services like telemedicine and other at-home healthcare services. I am ready to listen to you, the public, for input on what you want and need, take input from management and staff, which has been excellent, and work diligently with my fellow board members to make the best possible decisions for this valley. Audience, you've just heard from the 3 candidates vying for 2 seats on the board for the Bear Valley Community Healthcare District. These are both 4-year terms. Candidates, thank you very much for your time. We appreciate it. We will now take a 5-minute recess to set up for the next group.